your case?
Yes, good
We,
evening, ma'am.
we all know Dr. Arvind Moria very well.
Yes.
So we move
So
to the,
this case is right eye's vision is 618 and Dr. Arvind is going to implant Autofocus Pro. It's a polyfocal and a progressive lens, and it is, sir has designed it with a team of doctors, and it is giving distance, near and intermediate vision without any rings. So we are all here to see the lens, and he has almost finished removing the nucleus. Sir, I can
Can
take
we
the
have the
microscope.
microscope view, please?
Microscope. Microscope is not there.
Yeah. We can see that now.
there.
Very
okay.
nice.
Sir, you can take the
सलाइन
mic.
सलाइन कॉर्निया पे सलाइन डालिए
Okay, Arvind. No.
या
अरे
सेंटर पर डिस्प्ले
No, why are you changing? Can we move to the previous case, please? Vivekanand Hospital. Attention, AV team. Yes.
या
Yes, Arvind.
Yes, I can hear you.
So you're through with the nucleus now. You will be removing the cortical fibers, and which lens you are implanting?
Autofocus Pro.
Autofocus.
So this is the world's first polyfocal progressive IOL without any refractive or diffractive ring, and there is no posterior apodization also, and it corrects viscot. And it corrects all types of vision, distance, intermediate, as well as the near vision.
Arvind, can you tell us something about the optics? How does it do that? It does not have any rings. It does not have any apodization. Does it? Is it based on the spherical aberration concept?
It's based on the green technology, gradient refractive index technology. So in the superior part, the refractive index is 1.42, and gradually it comes down, so it is 1.54.
So which irrigation aspiration you use? Coaxial or
Bimanual.
Bimanual.
bimanual? Okay.
I'm going to use bimanual.
Let's see the.
So what machine are you using, Dr. Arvind?
This is lesion.
Okay.
Yeah. Lesion from Alcon.
So you have a very nice way of removing the cortex in sectors, small sectors.
Yeah.
So can we center the eye a little bit because it is gone off center? Move it towards you. Yes.
Yeah, is it visible? Yeah,
Yes.
आइए दीजिए
So
थोड़ा सा रह गया.
almost the entire cortex is gone.
Yeah, a little bit is left. I'm about to remove it.
Yeah. So there is a little fragment, I think, which is there at the side port also.
Yeah, that is, yes.
This generally happens
Yeah.
at the side port or at the main wound, small fragments,
Yeah.
especially if the cataract has been a little on the harder side.
इसको दीजिए. लेंस ओपन करवाइए.
So how do you, is it the normal, do you put it in a butterfly cartridge or
It comes in both the preloaded version also and butterfly cartilage also. The
Okay.
butterfly is hydrophobic plus hydrophilic, whereas the preloaded 2.6 millimeter compatible is 100% hydrophobic, and the toric version is ready, and within 3 months it will be commercially available. Extension. Return दीजिए. So myself has implanted more than 5,000 and not a single patient complained of negative dysphotopsia.
So for this, you have to extend the incision a little bit.
Yeah, 2.6 because I did phaco with 2.2, but
Okay.
it's 2.6 compatible. Yes. Table. Yeah.
Okay, so you are preloading it, means it's hydrophobic, hydrophilic platform.
Yeah,
You are
it's
loading
available.
it, I mean.
Yeah. Toric design is ready, ma'am. Within 3 months, it will be commercially available.
So which company is manufacturing it?
Lifeline Medical Devices Private Limited.
Okay, Lifeline
Gosh,
Medical Devices is
Yeah,
manufacturing.
yeah. So this IOL is Dr. Jagdeep M. Kakadia, Dr. R.C. Shah, Dr. Satish D. Sheth, myself, and the manufacturer is Dr. Vikrant Bhale,
Okay.
Lifeline Medical Devices Private Limited. So you can see it as a outer zigzag shaped this haptic design.
Dr. Arvind, you said the refractive index increases from top to bottom. So
Yes,
that,
now you can see these two holes are in the superior part. You
okay.
can see these two holes. So here the refractive index is 1.42 and here it will be 1.54. And you can see it just looks like a monofocal IOL, right?
So top portion is 1.41, middle is 1.54, you said.
Inferior most is 1.54, top most is 1.42.
And it is intermediate in the central optical area.
Yes, it is pupillary independent. Even in IOL power of 27, we have implanted this.
Dr.
That
Maurya,
means that means the orientation has to be kept very carefully, and the haptic, that means have to be kept superior and inferior. Because that becomes very important, because the refractive index otherwise will change
Horizontal.
if you.
Horizontal.
Dr. Maurya, in your experience, have you had any rotations of the IOL and how that has affected the IOL?
Sir, even of 30-degree rotation, there is no problem. If it is more than 30 degree, it can be redialed. You can see, and because these, if we talk about other IOLs, so only a part of that modified C loop is in contact with the capsular fornix. But here, the whole 6 millimeter of this L-shaped is in contact with the capsular fornix. That gives us excellent rotational stability. Echo देना बेटा एक बार. Low power में. So the fragment is left, so I am using phaco again. The case is over, and anyone can ask about this IOL, please.
Thank you. Excellent surgery, Dr. Arvind, and done very well, and beautiful implantation of the lens.
Thank you.
Thank you. So